teenagers with acne can suffer from anxiety, can suffer from depression. They, they avoid going to social gatherings just because of few acne. Now, it is important to understand that for them it is a big thing. Even though it might not be a big thing for us, but for them it's really a big thing. Going with a single bump in front of so many people, it affects their self-esteem, their self-confidence, and that is what we need to address.
Welcome to Food Pharmacy Podcast. Today with us we have Dr. Ishaan Pandya. He's a dermatologist. He's been practicing for 5 years at his clinic called Lumos in Memnagar. He's expert in psychodermatology and he believes in holistic approach in treating his patients. Welcome to Food Pharmacy. We are so happy to have you here.
Thank you for having me here. I'm just looking forward to this wonderful talk about diet and dermatology that we are going to have today.
So, skin is the largest organ in the body.
Yes.
And how can we determine the health of skin?
So basically when we talk about the skin health, so what we are looking for a smooth skin, right? Then a skin that is not sagging.
Okay.
Like if you are doing this, it should return to normal within a few seconds.
Right.
That is what is considered as healthy skin. There is
Right.
no rocket science in defining a healthy
It is not
skin.
about the color
Exactly.
of the skin or the texture.
Yes, texture we can still say that it should
Okay.
be smooth,
Okay.
but rough, because rough skin may indicate that your skin is dry or dehydrated.
Right.
Yes, right.
Okay.
So yeah, rough texture of skin matters, but color of skin doesn't matter.
Right.
A healthy skin can be of any color.
So, what would you talk when we ask about the deficiencies which are related to the skin health?
Very first and foremost deficiency, that's water. The first signs of dehydration, when there is a less intake of water even for a few hours or a few days, the skin starts getting wrinkled, or even those specifically who are having tendency for dry skin, they start having cracks in their skin, their lips start chafing and all. So that is the first sign that you should take enough water.
Yes.
Right?
Hydration.
Exactly. Next, when we talk about certain vitamins or proteins or minerals, so a balanced diet or a balanced nutrition is very essential for skin. There is no one vitamin that you will take and your skin will overnight become glowing. That's not the thing, right? Skin is
Right.
also a part of the body and requires nutrition in all the parts.
Right. So, skin health is related to the intake of vitamins and minerals
Yes,
that we have
exactly.
in our everyday food.
Yes, very true. Specifically for skin health, if we talk about certain important vitamins, so very first comes vitamin A.
Right.
So what vitamin A does, vitamin A is very essential for skin health, and it is very essential for skin turnover. So
Okay.
what does skin turnover means is that from the base layer of the skin, there is constant cycle of skin cells coming up to the skin.
Right. So skin has 7 layers,
Skin
and then we
has
start from the bottom layer.
yes.
Okay.
So when from the bottom layer, the cells come upwards,
Right.
and the topmost layer is basically, it is, we can say it as dead layer of skin.
Right.
The topmost layer.
Okay.
Right, but it still has nerve endings and blood vessels and all. So vitamin A controls this thing, how fast the cells turn over,
Okay.
skin turnover rate. So in vitamin A deficiency, you may see vitamin A deficiency or nutritional or hypervitaminosis. You can see that skin is becoming flaky, skin is becoming dry.
Okay,
So
so that results into the
flakiness
skin,
of skin
and
may
also
occur.
the coloration might change
Coloration
because of
might
the same.
change. Yes.
And then we might not know, and we'll just put the cream on it.
Yes,
We'll keep
exactly.
on putting cream or any other, like a jelly, like a petroleum
Yes.
jelly to it,
Yes.
to resolve it. But
Resolve
then the
it.
underlying issue is not resolved.
True.
Because of that one deficiency of vitamin
Vitamin
A, all
A.
of this can happen. And
Yes.
also there is a study which talks about vitamin A and hair health.
Yes.
So when there is a decrease in vitamin A, you also figure out there is a hair loss.
Hair loss. Hair loss is again connected to so many other vitamins also.
Right.
Right.
Okay. So now you want to talk about the prevalence of the skin concerns like psoriasis or
Yes.
acne or dehydrated skin.
Right.
So please give your emphasis on what is psoriasis and what are the common myths for it, and also how can we improve that skin condition through food.
For psoriasis, it is very important to understand that even though it is just a skin disease, yes, of course, it is not infectious, right? It
Okay.
may be or may not be genetically determined, right?
Okay.
Like if it can happen even if your family doesn't have psoriasis history, so it can be or cannot be related to that.
Okay.
Then even though it is just a skin condition, there are other systemic conditions that is associated with it, like obesity, then diabetes, hypertension, high blood
So all
pressure.
of this has a relation with psoriasis?
Yes, they have a relation with psoriasis. Even when we talk about psoriasis, there has been studies that indicate that uh, myocardial infarction, that is also known commonly as heart attacks,
Yeah.
it is also related to psoriasis. So
Okay.
when we see the patient of psoriasis, we always confirm, or we always see that the patients doesn't have any of these conditions.
Yeah, so blood work is what we do first when we see a patient.
Yes. It is such a chronic condition, such a long condition.
Is it painful?
No, it is not painful.
Okay.
There is another part of psoriasis which can affect your joints, which is
Right.
known as psoriatic arthritis.
Okay.
It can be painful and it can be very debilitating, and you can require very acute treatment for that.
So can psoriasis be misunderstood as an allergy?
Yes, very
Because
commonly.
of the redness
Yes.
in the skin.
Yes. Psoriasis can be misunderstood as many other conditions. People usually don't come directly when they first identify a patch or something. They usually start treating it as eczema,
Eczema, yes.
right? Eczema, allergies. But when it starts spreading, they usually consult a dermatologist.
Right. And from food point of view, what food should be allowed in a psoriasis patient, and what food should be definitely said no in a psoriasis patient?
Right. So definitely no sugar, right? High glycemic index foods, carbohydrates.
Carb-rich foods.
Yes. Then all these carbonated drinks
Yeah.
and all.
So anything which has refined flour, refined sugar, and
Yes.
refined oil in
Yes.
it should be definitely avoided.
Yes. Then foods containing omega-3 fatty acids are beneficial in
Yes.
psoriasis
Okay.
because it provides the moisture from the inside.
Right.
It has the essential fatty acids that can provide moisture, and also they don't increase the cholesterol levels also.
Yes, because it's a good fat.
Yes, it's good fat.
Now I want to talk about a very common skin condition which is very prevalent in all age groups, and it is also very common in men, women both.
Yes.
Number one, acne. So what is acne?
So acne is definitely one of the most common conditions that we see in our routine practice, and usually in 90% of cases it is usually seen in patients who are from 11 years to 30 years of age.
Okay.
And because during this period the hormonal changes that occur, it can result to excessive oil production, specifically on face, on scalp, on back,
Okay.
on upper chest. So
Right.
these are the common sites where oil glands, we also known as sebum,
Okay.
right? Sebum production increases. So oil glands are in a more number than other parts of the body, specifically
Right.
on these areas. So when hormonal changes occur, the production of oil increases, specifically from these glands, and it can result in various degrees of acne, right? In different people, different degrees of acne is seen at different points of time.
Okay.
And it is not, we cannot determine that between 11 to 15 it will be less, then after 15 years it will be more. It's not like that. It differs from people to people.
But once a patient who has acne has it for prolonged period, and it is probably it resolves in certain season or atmosphere, but it's definite to come back periodically. Why is it that?
Yes, so there are so many factors that affects the acne outbreaks.
Okay.
Right? The different types of acne, first of all, if we talk about, like, very commonly we say blackheads, whiteheads.
Okay.
They are all types of acne.
Okay.
Then we see red color bumps, then
Yes.
pustules, and
Yes.
then in very severe cases we see very big cysts and nodules, and it can result in scarring and
Yeah.
pigmentation. You asked about why acne occurs in periodically, like sometimes the skin is completely fine, sometimes it's not that much, like sometimes the acne outbreaks are there. So it depends on so many factors. First of all, as we are talking about diet, it is definitely one of the most important factors in development of acne. Right now, the teenagers that come, they are so much into
Junk food.
and
Yes.
desserts and everything.
Right.
So it tends to increase their acne outbreaks. Also, the season also matters, like in humid environment, just like we are having right now since past 2 to 3 months. So in humid environment, skin constantly remains oily, and if you don't wash your face frequently enough, it can result into accumulation of oil, and it can result into acne outbreaks.
Right.
Then stress is another very important.
And hormones.
And hormones, yes. Like if in women specifically, if we consider, so before periods or after periods, they get acne outbreaks. So these all are factors that are responsible for
But that
acne
is,
outbreaks.
it's very periodic, so it is only there for few days
Yes.
and then it
Yes.
goes.
Yes. Yes.
So that shouldn't be considered as an issue, or
Exactly.
the medicine for that shouldn't be taken.
Right.
A person has to self-heal in the
True.
same.
In very minor cases of acne, if you are able to accept that 2 or 3 pimples are going to come now and then, it's completely fine. We don't even give give the medications, because it's completely normal.
Yes.
To have some or the other. Now, when we require medications, when you have very severe acne, right? And when you have habit of scratching acne, because scratching can
Then
lead
the scarring
to,
comes into the picture.
Yes, then scarring and pigmentation comes.
Right.
So that is where the medication is required.
Right. There are so many myths around skin, and sometimes this food can be eaten, this food
Yes,
cannot be
yes, yes.
eaten. And first, I would like to emphasize on the myths of vitiligo.
Yes.
What is vitiligo, and why is it that people are scared of it?
There is a history behind it, that why people are scared of vitiligo. So in the ancient times, there are two diseases that produce white patches on the skin. One is leprosy, and
Yes.
another is vitiligo.
Yes.
So in ancient times, there were no methods to differentiate these two.
Right.
So leprosy is a very severe disease. It's an infection. It can spread through contact, and it's a life-threatening disease over a period of time. While vitiligo, on the other hand, is a relatively very benign condition.
Right.
It just has white patches on the skin due to destruction of color producing elements, that is
Okay.
known as melanin.
Yes.
Right? Destruction of that. So in ancient times, there was no differentiation between them. That's why people used to stigmatize those patients. But now, what happens is that vitiligo is mainly stigmatized because of the appearance.
Right.
Because of the patches of white skin that appear on a normal person. That is why vitiligo is very stigmatized. It is not infectious, it is not spread by contact, it is not due to any kind of diet. Now we are speaking about myths about diet.
There is
So
a common thing in Ayurveda which says that dahi, like a curd, and besan, if eaten together as mixed form, can result into vitiligo.
vitiligo has no role in with any kind of diet. Now, similarly, that you said that besan with dahi, I also get patients who have the myths that any white thing that they will eat will cause white patches on the skin. All kind of dairy products, cheese and butter, dahi, everything. So yeah, these all are myths about vitiligo, that it is not related to food. It's a very multifactorial disease, we can say. So only genes only having genes or only having family history of vitiligo does not guarantee that you will have vitiligo.
Right.
Even you can have vitiligo, I can have vitiligo.
It depends on the body metabolism.
Yes.
And
It's a roll of dice.
right.
That you get a vitiligo.
Right.
And it is not something to feared about, right?
That's the message that we want to pass across when we are talking about skin and health. That vitiligo is not something to be afraid about.
Yes.
For sure.
And people, there are models with vitiligo.
Supermodel.
Supermodels.
Lastly, we want to talk about a common issue called rosacea. So it's so prevalent, and we have suddenly seen the spike of the issues.
Yes.
First, so what are the symptoms like, and then how can we prevent it?
So rosacea again affects the face, specifically over the nose area and spreading onto the surrounding area, cheeks, right? What we commonly know it as butterfly area of face,
Yes.
right? This area.
Yeah.
So rosacea specifically affects that part more, and it is very much connected to diet.
Okay.
When we eat hot, spicy foods, it triggers rosacea. And it is not like that it triggers after some point of time. It immediately triggers. It immediately patient develops the redness or itching, or
It's just the butterfly area, or
yes,
even around the lips.
it's
and
in the
other-
butterfly area most
Okay.
commonly. It can extend up to lips also. Starts from here.
Okay.
And yes, as we talked about triggers, so hot food, spicy food, then hot oily spicy food,
Okay.
then alcohol, smoking, even sunlight, all these things can trigger rosacea.
So when people apply a cosmetic on same, what happens then?
So cosmetics are again uh, cosmetics are products that sometimes in few patients patient can be allergic to that.
So there is like a new supplement which is called biotin.
Yes.
So the relevance of biotin is to be that it's going to improve your skin, hair, nails.
Yes.
So how would you suggest us to use such supplements, and
Right.
what is the effectiveness of using such supplement with the food?
So when we talk about biotin, it is a type of vitamin B only. It's
B complex.
B complex, right? And biotin is specifically essential for the health of skin, hair, and nail.
Yes.
Right. However, there are no established studies that has proven the role of supplemental biotin that is given from outside as a supplement in skin, hair, and nail conditions. But practically, when we see patients, and we have been writing biotin as a molecule in specifically hair patients,
Right.
patients who are suffering from hair loss.
Okay.
So they have definitely benefited. There might be
That's
other
a great thing.
yes, other factors also might be playing a role. But practically, we have seen
Biotin is effective
in specifically cases of hair loss.
Okay. And the relation of the same with skin health and nail, because cuticles are also one thing.
Yes.
We have cuticle creams now.
Yes.
So how can this improve the health of same?
Biotin also improves the health of nails also.
Right.
In skin, we don't use much of biotin supplements, but
Okay.
specifically for hair and nails, it is useful
Alright.
practically. Theoretically, the studies are yet to published to which can prove the role of
To
biotin.
show the efficacy
effective,
of it.
yes,
Right.
efficacy of
And
biotin.
lastly, we want to emphasize on the star product which is called hyaluronic acid. So every cosmetic brand is talking something about the same, and also the hyaluronic acid has this effect on the skin or in the body, which is a question.
So hyaluronic acid has effect on the skin.
Okay.
Because many of the creams or many of the lotions, they contain hyaluronic acid as a very prominent molecule.
Right.
So hyaluronic acid, we can say it's a kind of moisturizer, but it's a very
Okay.
potent one in that. Like
Okay.
it can retain the moisture.
But hyaluronic acid is also used for skin whitening, right?
Hyaluronic acid,
There is a
no.
myth, or it's
Yes.
not?
No, hyaluronic acid is not used in skin whitening, but yes, there are other agents which are usually combined with hyaluronic acid, like we can say niacinamide, vitamin C. These two molecules can produce skin whitening. It acts on pigmentation, but hyaluronic acid is something that maintains the moisture of the skin. So when we talk about facial skin, so if you start applying hyaluronic acid regularly, you will see there is a kind of a very good hydration of the skin. You will feel your skin very plump. That is what hyaluronic acid does. It retains the moisture without producing the oiliness or acne breakouts.
All right.
Yes.
So it can be used by acne patients as well.
Yes. And it can also for those patients who specifically undergo some procedures, cosmetic procedures, laser procedures. It can also help in that also. Post procedure, it is very useful.
So you being a psychodermatologist, we want to ask you a very important question on teenagers' skin health and also its direct correlation with mental health.
Yes.
So when a teenager will have an acne or any issue with skin, they are so much scared to show their skin, and that impacts their mental health at certain point. So why does this happen and how to solve it?
When we talk about skin is the largest organ. Skin is the most visible organ of the body. So anything that is going to affect skin, it is going to affect your mental health in at least in some proportion. Teenage is a very tricky age, you know. So when we talk about teenage is an age when a person is transitioning through many changes, be it physical changes, be it mental changes, hormonal changes, or be it changes surrounding their environment. Overnight, they start comparing themselves to others.
Right.
They start believing the social media or their friends more than their parents. And it's a very normal thing. When you go through teenage years, you always look up to someone who is of your age, who is of your friend. And at that time, the parents take a backside. Right. So that is why it is important to understand how a teenage mind works. The emergence of social media is a huge thing has a huge impact on mental health. Use of filters, because they all want to see how other people's, they want to see flawless, right? So that is why even a tiny acne or even a single bump can affect out of proportion to their mental health. Like what I have seen is teenagers with acne can suffer from anxiety, can suffer from depression. They avoid going to social gatherings just because of few acne. Now it is important to understand that for them it is a big thing, even though it might not be a big thing for us, but for them it's really a big thing. Going with a single bump in front of so many people, it affects their self-esteem, their self-confidence, and that is what we need to address in teenagers.
So how can we help them?
We can help them, first of all, we can understand them. That is the first. We can listen to them, what they are going through. But those who have social anxiety, specifically related to skin condition, they'll have different reasons to them.
Right.
Even they have an umbrella term of social anxiety, but there will be different reasons behind that why they are feeling anxious or why they are avoiding going out. Someone might say that I have always been flawless and this is something that I don't want to show to the people. So everyone has different reason. It is important to know what that reason is and why it is developed. That's a very deep history taking.
Also, it's important to tell them if they keep on taking stress or being anxious about it, it's going to worse the situation. It's not going to improve or reduce the acne. And acne, as we discussed before, it is periodic. It can go, it can come. It is not a permanent state of the skin.
So again, when it comes to stress, right? Stress can induce acne, and acne can trigger more stress. So it's a vicious cycle. Right? So we have to stop it at least somewhere. So That is why when I talk that treatment of acne is important in that way, that it can improve the mental health of the teenager, and along with that we can work on their this aspect also.
So it's a very a direct message to a caregiver or a parent that number one would be to probably reduce the stress, and then number two would be to improve good diet.
Yes.
Definitely reduce the sugar, the junk food, and also increase exercise, which can improve their metabolic
Yes.
functions, and reduce this and
Yes.
make getting an acne should be a normalcy.
Exactly.
Right?
It should be seen as a normal thing, just like when you go through teenage years, you develop body hair, right? You develop facial hair, just like that you develop acne.
Right.
It should be as normal as that, unless it's very much severe that it requires correction or requires treatment.
So, as you have come to our store, Food Pharmacy, what do you think about the store, and how would you like to recommend it to our viewers and your patients?
So I think it's a wonderful store, and specifically who are looking for healthier options, sugar-free options, options with high protein,
Yes.
options with specific nutritional supplements. So I think you have a very good collection of all of them, and I have seldom seen such kind of collection anywhere. So I really appreciate the work that you are doing, and it's a really wonderful
Thank you so
thing to
much.
visit over here.
So that is end of our session, end of our podcast. We had a great podcast today with Dr. Ishaan, expert psychodermatologist. We got so much insight about what is the right kind of food for our skin and our hair, and also effect of sugar on our health, which is the worst thing.
Thank you for having me over here for this wonderful podcast.
Thank you.
And it was wonderful talking about so many things. And the message that I would like to tell to the people who are watching this is that keep it as simple as possible when it comes to the skincare, and the healthy diet or eating healthy, make it a habit rather than just something like a crash course or a periodic thing. Normalize skin issues that teenagers have or any other people have, and consult a dermatologist if you find it bothersome.
Please, if you guys have any questions in the podcast, mention below in the comments, and please subscribe to our channel, Food Pharmacy. See you guys until the next time. Stay healthy and stay happy.